I have been a healthcare worker for 30 years. I started off as a personal care attendant. I went to registered nursing, registered midwife, and then I've been working as a maternal and child health nurse.
So I'm here to support my colleagues who have been terminated last year because of the mandated vaccines, and to show the public that we are here willing and able to contribute to the workforce where we belong, where we studied, and it's really, really sad. It's heartbreaking, actually.
I'm a midwife and I'm a nurse, and I'm also a lactation consultant, and I've been a nurse for 38 years and a midwife.
Well, we're out here today just to draw attention to the fact that there's thousands, literally thousands of nurses who are ready, willing and able to work, and they can't. These vaccine mandates that have rolled out, they've resulted in just so many staff leaving or retiring or being dismissed from the profession. Australia-wide, we're aware that it's tens of thousands, but in Victoria it is most definitely in the thousands.
Hi, I've been a nurse for over 30 years, 33 years actually. I specialize in emergency nursing, and I have not been able to work for the last 5 months.
So many years of service in this collective of nurses that are currently not able to work. Years and years of training.
We are all standing here because we know it's wrong. The decisions have not been wise of the government at all.
And I've since been terminated from both jobs. Apparently I was a clear and present risk to my colleagues and my clients, so I was terminated from both jobs. So here I am, unemployed. Not really good for the families. I feel like they've been left behind. They're unable to get appointments with health nurses. They're only seeing children up until 8 weeks of age, and the other families are missing out. So here I am, Bourke Street Mall, just saying please end the mandates, let us get back to work, let us see our families and our clients.
Staff ratios are out of control. There's 6 to 1 nurses on many units. On night shifts there's 10 to 1. It's terrible, and patients will die because of it.
In aged care for 18 years. I had COVID last November. I have a medical exemption and my work still won't let me go back to work.
The health system has been absolutely run in the ground by ridiculous mandates and rules which are adversely affecting not only just patient care, but the lives of the people who are actually there saving them and supporting them. And the way the whole system has been managed is absolutely diabolical and farcical, and I'm here to voice my protest about it.
And we've got all of these workers here who are capable, they're qualified. We've got 30 years of service, 20 years of service. We've got decades of service between these workers. And if we were just to simply rat test them, send them back to work, they could do their jobs, because you can't spread a virus you don't have. And the vaccine mandates, well, they're not really working. You know, we've seen that between 3,000 and 5,000 workers have been stood down each day at some points in this state, and that's documented. That is fact. So what's the purpose of the mandates if it's not reducing the spread?
And I'm here because I was stood down on the 15th of October due to the mandate. And I actually want to work. I miss working, but I'm suspended at the moment. And it doesn't look like I will be able to go back unless I accept the mandatory vaccinations.
So there's all these nurses here, they're ready to go back to work right now, and they're not allowed to. Meanwhile, there's provisions in the directives that allow nurses who are actually tested positive with COVID but are vaccinated, they can go back to work. But these nurses who can be rat tested and can be shown to be completely free of COVID are not allowed to work. It doesn't make any sense. These staff need to be allowed to go back to work, to get on with their own lives, but also to be able to look after the patients.
I work in community care, so that means I mainly work from the office. I can work from home. I can see my clients and I work safely. All during the pandemic when it first started, I would meet my clients outdoors if need be, to review their care plans and things, and that's what I do in my job. So I'm not allowed back to work.
The reason is because of the hospital mandates, the government mandates. So even though I'm a specialist emergency nurse, I can't work because of the current mandate, and it's really sad, I think, because I'm ready to work, and a lot of people that know me know that I'm a very good emergency nurse, but it's a staffing crisis we have, and yet people who have COVID, nurses who have COVID, can go back to work, but people like me who is very well, and just because of my decision not to have the vaccination or the jab, I can't work. So
they've done training to be general nurses, to be midwives, and then they've done training in maternal and child health. But the thing I want to mention is the fact that several of us have already had COVID and recovered. We've got exemptions, but they are not being recognised by our workplace. And so the workforce is depleted because we are not able to return and to give the quality care to our families and to our clients that we would love to give and that so badly need us in the service.
There's a lot of shortage even in my department, and I used to look after mothers and babies and I just miss it really.
Something is very wrong. It's not about health, and we do need to get to the bottom of this, and we do need to put people back into their workplace and reverse this whole mandate.
We're advocating for rat tests, get our workers back, get our healthcare sector, back to where it should be. That's what we're here for today. So we're trying to get some support from the public to help us raise awareness on social media and advocate for our cause, because there's been some really awful stories of people passing away because they couldn't get an ambulance. Now, I think most people would agree that if you've got an emergency at home and a loved one stops breathing, you don't really care who picks up is on the end of that dial tone. You need that help and you need that support, and people aren't getting it. And we've got all these workers here, right here. It's not rocket science. There's ways to mitigate these risks that we talk about, and nobody's even discussing them. We're not even looking at them. So that's what we're here for, to bring that to the forefront and hopefully start a good conversation.
And the impact that not having our careers or working has been enormous. I mean, all our goals, all our dreams have been turned upside down, and we would like to start working again and be allowed to return to work.